And how effective, and this just goes back to the point that you were mentioning earlier, how effective do you believe the first generation of COVID vaccines will be, and for how long will they continue to be effective?
So that's the million-dollar question, because the T-cell response is an indicator of how you will develop your long-term immunity and have immunity, after your antibodies wane off in 3 or 4 months. It's your T-cell CD4, CD8 response which will give you that immunity if you're under attack after a couple of months. Now, whilst that indication is strong and good with the Oxford candidate and some of the others we're working on, not all the other candidates in clinical trials have shown that. And having said that, it's still not a guarantee. So I must make that clear. It's only after a year or two when we actually see vaccinated patients or people, whatever, being protected when they are exposed to the virus, if they're exposed to the virus, that we will know that the vaccine has given you that long-term immunity. So we will have to wait for a year or two to really know that beyond reasonable doubt. But the indicators are all positive. The science is very positive to indicate that you will have that long-term immune response.
Would there be a requirement for, say, a booster dose after a few months, even initially?
Oh, absolutely. The Oxford vaccine is going to be a 2-dose vaccine. Most of all the other candidates are going to be 2-dose vaccines. In fact, if you look at all the other vaccines that have been given to children, they're 3-dose vaccines. Pneumonia, measles, 2-dose, you've got pentavalent. Even the HPV vaccine given to adolescent girls is a 2 or 3-dose vaccine. So most vaccines need the second and third dose to give you that boost and long-term immunity going forward.
And do we know when that booster dose, the first one, would need to be administered?
At the moment, like it's being done in the trials, it's a 28-day or a month, you can call it, gap between the first and the second dose.
All right. Will Covishield impact different age groups differently?
Well, of course, all vaccines give a different immune response. If you're young and fit and healthy and your immune system is robust, you will probably respond better, to a vaccine. I assume the same will hold true even for this vaccine. And having said that, the concern was that will the elderly be protected? We've incorporated that, as you must have heard that, we added the older generation also to our trial here in India to prove just that. The UK has done that also and shared the data publicly to say that it does give an immune response with the elderly, which is good news. We were always fearful of that whether it will protect the elderly as well. That was our concern. So, it will give a slightly different response, but it seems at the moment we're going to get a response both in the young and healthy and also the elderly.
Just to come back to the point on booster doses, when would the second booster dose likely need to be given?
Now, as I said, a month apart. So you take it today, let's say, one shot, and then you take one after a month. That's what's happening in the trial. That's what the UK is doing. That's what we're doing in India. And we recommend that even in the program going forward, after licensure.